understanding how a torn Achilles tendon actually heals is very useful because then you can understand what the goal or the aim is with the different steps in the treatment process. The first thing that happens when you tear a tendon is that there is inflammation that starts. And this inflammation usually peaks within 1 or 2 days. Now, before you reach for anti inflammatories, the inflammation is actually a really important part of the healing process for tendon tears. It's different with Achilles tendonitis or tendinopathy. That process is a totally different process. So this only applies to Achilles tendon tears. The inflammation is there to clean up the area so that healing can start taking place. It gets rid of all the broken cells and it stimulates the body that it brings blood supply and everything it needs for healing to that area. At the same time, you start forming a scar in that area. Now, scar tissue has gotten a bad name on the internet. Everybody's forever on about, oh, you've got to get rid of the scar tissue. Scar tissue is an essential part of how Achilles tendons heal. And scar tissue can be either functional or it can be problematic. And functional scar tissue is what we in medical terms call scar tissue when it's doing exactly the job it should be doing and it doesn't give you problems afterwards. So I'm going to explain to you how you can get functional scar tissue. The first step in forming scar tissue is that you're getting scaffolding that forms in that gap where the tendon tear is. And the aim of the scaffolding is to bridge the gap and give the new cells something to come and attach to. Now, you could think of it like an internal scab. You know, when you cut yourself, you get a scab, and that's exactly what that scab does for the skin. So this is now happening inside your tendon. It's not hard there. It's nice and soft, obviously, because it's all wet and inside the body. And the first cells that come and attach there are collagen type 3 cells. And these cells aren't very strong. It's not the type of collagen you want yet. And everything is a little bit disorganized. It's not in the nice straight lines because we know in healthy, strong tendons, the collagen fibers are aligned in parallel, and that's what gives it its strong structure. So the next stage in the scar becoming a functional scar is that these cells have to be replaced with stronger, proper collagen that can withstand the forces you want it to withstand. And the fibers need to align that it goes in line with what the direction the tendon works in. Now, how do you do that? Often on the internet, you'll see claims that people say, oh, they are breaking down scar tissue with their hands and getting it to align. You can't actually change the tendon scar tissue through massage or hard pressure on it. What it needs is it needs to be loaded in the direction that it is going to work eventually. Think of it as pulling the tissue slowly, slowly over time into the direction it wants to be in. And the force from the careful loading is progressively getting the tendon to renew those cells, because the brain, every time you do some exercise that loads it a little bit more, the brain goes, oh, actually, we need that area to be stronger. So I need to replace those cells with stronger, healthier ones. And it slowly exchanges those cells for the types that's more useful to you. So these processes all overlap. Your inflammatory phase starts pretty much immediately after your injury, and it lasts for between 3 to 5 days, depending on the size of the tear. It may be a little bit longer, but it's usually during that period. If it's a very small tear, it might be over within just a day or two. And the scar formation, or what we call the regeneration phase, because we're creating the new cells, starts very shortly after the inflammatory phase has already started. So they overlap. And then we call the process of getting the cells to be replaced with a new, stronger type of collagen plus realigning, we call the remodeling phase. And that phase takes quite a bit of time. To be honest, depending on the size of the tear, it can take 6 to 9 months and sometimes even longer. It just depends on what's going on in there. Why do scar tissue sometimes become problematic? Because, yeah, scar tissue can cause trouble sometimes. Well, the first is if it becomes excessive scar tissue. And it becomes excessive when there is really excessive bleeding and swelling in that area. And the most common reason that happens is because people aren't giving that injured area enough rest. They try to train on it too soon, or they're trying to just push through the pain and continue after they should have stopped a long time ago. And it's about giving it the right level of protection, which we'll talk about in a minute. The second is it goes and attached to other structures around it. So your Achilles tendon lies quite close to other tendons as well as little nerves, and everything is supposed to slide past each other as your body moves. That's how we're designed. Now, sometimes it gets stuck to other structures and then it tugs on them as it moves, and it can cause nerve irritation and all sorts of things. So, but I should also say, if you do have some nerve symptoms early on, it doesn't mean that that's happened to you. It can also just be that the nerve got stretched heavily when it was injured. So don't think that's definitely the cause there. You usually only see that much later in the recovery process, those symptoms come out. So what causes it to attach to other things? Again, it's if there was excessive inflammation in that area, or excessive bleeding in that area, or excessive swelling. So that's why we're on about protecting it and giving it the right level of activity during the early stages, because it's so important for that. Then also, if the scar cells are never replaced with stronger cells because you're overprotecting the area, you're not actually following the right type of loading plan at the right times and building it up to the level that you need for the activity you want to get back to, then the remodeling doesn't really take place, and then the scar becomes problematic. But then, fourth reason is sometimes it's just bad luck. Sometimes you do everything you should be doing to the T, and then you get problematic scar tissue. But the good news is there are ways to deal with that as well. And often, like for instance, if it does attach to other things, doctors will just go in and either do minimal invasive surgery for it, or a very common way is that they just do, under ultrasound guidance, use a lot of clean water fluid that they inject in between those structures and get it to separate, and then things can be much more comfortable. So don't worry if those things happen. There are things that can be done about it. And even if you might have overprotected your tendon too much at the start, you can always change scar tissue later on still. There's very little research in how long scar tissue takes to actually properly change in tendons, but there's lots of research in plastic surgery, because guess what? People really care about that in plastic surgery. And it shows that scar tissue can still mature and get better up to 18 months after the surgery. So don't think that it is something that is never going to change. It can always change. My take-home message for the healing process is that it's all about balance. Yes, rest and protection is important, but loading and getting the load right depending on the healing stage is equally important. And these should be in balance throughout the period. So I will discuss and explain how you can get this rest versus loading right under the treatment section later on. But let's first look at what your recovery times might look like.